All right, now we are moving on to this patient's jawline. We have just completed her chin filler. If you can see from the side, her chin looks beautiful. She has a nice, smooth appearance. She had a little bit of an indentation in the center of her chin, which she requested to have a bit of a softer looking appearance. And so we did place a heavy filler in the chin, and now we're coming back to the jawline. We teach jawline filler in our level 3 dermal filler course. This is an advanced course for injectors who have a fair amount of experience. They're really, really comfortable with their anatomy and really looking to elevate their practice with advanced skills. In addition to jawline and chin, we also teach under eye, temple filler, and so there are a lot of skills that you can add to your practice once you take your level 3 course. It will allow you the opportunity to really do a full facial assessment and address full facial balancing, profile balancing, and all of those things that come into effect when we evaluate our patients. So let's talk a little bit about the jawline here. You can see that we have marked out the mandible and the ramus. So that's your marker going vertically. That is the angle of her jaw. And we have a couple injection points marked there that we're going to be placing bolus injections deep on bone. And this is basically just trying to exaggerate the angle of the mandible. And so as we age, when we lose bone, we tend to lose that angle of the mandible, that jawline appearance, because we're losing bone structure. And so when we use a heavy filler, we're trying to restore the volume loss and also the structure that we tend to lose with age. And so you can see here with every injection point that we have, the injector is going in, aspirating, and then slowly administering the bolus. We always recommend really slow injections in this area and always watching your tissue. If you are to identify any changes within the tissue, the patient reports pain, you would want to stop injecting and assess for potential vascular compromise. So in any event, everything's going along swimmingly here. You can see how already it's starting to take some shape here. And we're going to try and form a little bit more of this jawline so that she has a more youthful appearance. Her main concern was her jowls. And so oftentimes we can approach that with injecting chin filler and injecting filler along the mandible. And as we are right now, we're going to go in with a cannula and delivering some support here where she has lost it. And oftentimes that can help smooth out that jowling area. When we build support both in front of it and behind it, sometimes we can get that nice straightening out. And so that is what we are trying to accomplish today. So jawline oftentimes is done with a combination of both needle and cannula. So we already did our needle injections, our bolus injections, and now we're going to come back with a cannula. And so we're just creating our pilot hole here where we're going to place our cannula to deliver our dermal filler here. That depth looks perfect. You do not want to be deep along the jawline when you're crossing over that antegonial notch. As we all know, that is where your facial artery emerges into the face, and it is deep. It's deep within that notch. And so therefore, when you're putting cannula over that notch, you must be more superficial. And so we do give injections deep on bone within the angle of the mandible, but along the mandible, you should be using cannula just to ensure safety and making sure that you're not going to come too close to the antegonial notch. So we're using a Comfortox blunt tipped cannula here. This is the 50 millimeter length, 25 gauge, and the injector is just trying to get her cannula into the proper plane, just sliding alongside this ramus so that we can give her some support in the back, which will help pull and minimize the jowling. And you can already see the patient's jowling looks already a little bit smoother just with giving her some support along the jawline. Okay, so here you can see her depth. It looks great. Cannula can be a little bit of a difficult skill if you're not comfortable or you're not familiar with a cannula, and sometimes it takes a little bit of extra time. This here is an injector in training. And so this is very normal and natural that you might struggle a little bit in the beginning until you become familiar with really how to manage a cannula. You don't have the sharp needle to help you out in this instance because your cannula is blunt. In addition, because she's using a 25 gauge cannula, it is a little bit more flexible, which could be to why she is struggling a little bit here getting into the hole. But the reassuring thing for you is that cannula can be difficult to sort of wrap your head around and get comfortable using. But once you do, I think you'll find a lot of comfort in using a cannula in certain areas that are a little bit more high risk. Okay, so she's in. And just because we're using a cannula, we still will need to aspirate just to make sure that we don't get any positive flash before injecting. So we're just sort of confirming placement here. Okay, perfect. So she's going to aspirate. And now she's going to go ahead and push the filler into place. I generally like to put my finger behind there, behind the ramus, so that way we can sort of trap that filler exactly where we'd like it. That again is going to help pull back and smooth out the appearance of the jawline, giving her support there that she's lost over time. And then once you're finished with the jawline, it's nice to give them a nice massage. You want to make sure no lumps or bumps before sending them out the door. We would love to see you in a level 3 course so that we can teach you chin and jawline procedure. This is in right now. This is what everybody's looking for, and it's a great skill to add to your practice.